Today we will discuss about the difference between sebaceous cyst and dermoid cyst. For that reason, we will just give a short review of cyst. So we know that it's like cyst. The cyst is like a closed sac. Cyst is like a closed sac lined by epithelium and filled with gaseous liquid or semi-solid substance. So we just can tell it like that. The definition of cyst: a cyst is a closed sac like structure that is abnormal but not cancerous. The cyst is a closed sac like structure that is abnormal, non-cancerous, filled with liquid, semi-solid or gaseous material. Liquid, semi-solid or gaseous material and lined by epithelium. If we talk about basic structure of a cyst, the wall is lined by epithelium except pseudocyst. So we will discuss in the next class that the classification of cyst. We will say that the cysts are mainly two types: true cyst, false cyst. So that's other topic. Content like fluid, pus, blood, keratin, sebum, or even hair. Location: all part of the body. Cause: congenital, obstructive, infectious, traumatic, or neoplastic. Symptom: asymptomatic but may become painful, infective, or rupture. So that means cyst may be asymptomatic or maybe painful, infective, or rupture. Diagnosis: for diagnosis we can do clinical examination, ultrasound, CT or MRI, or histopathology. Treatment: observation, aspiration, or surgical excision depending on type. So we can just say it in one sentence: cyst is a closed sac lined by epithelium filled with liquid, semi-solid, or gaseous substance. So today's our topic is the difference between sebaceous cyst or dermoid cyst. So you can see that that's a sebaceous cyst and that's a dermoid cyst. So just look at the picture for a moment. This is sebaceous cyst. We can see here a punctum and that is a cyst. So obviously the criteria of a cyst is located here, but there is some special feature. For that reason they are differentiated. Sebaceous cyst has an special criteria or characteristic, that is it has a punctum, and sebaceous cyst mainly formed as a result of obstruction of sebaceous gland or duct, sebaceous duct, and that is dermoid cyst. This may be congenital and there is no punctum here. So we can just look at the difference. Sebaceous cyst may be called as epidermoid cyst or epidermal inclusion cyst, dermoid cyst, inclusion dermoid, or congenital dermoid. Very important, congenital dermoid. Origin: blockage of sebaceous gland duct. I told it before. The sebaceous cyst is formed by the blockage of sebaceous gland duct, and dermoid cyst trapped ectodermal tissue during embryonic development. Lining: stratified squamous epithelium. So we know cyst is a closed sac lined by epithelium. The epithelium is stratified squamous epithelium with sebaceous gland. Sebaceous cyst with sebaceous gland, and dermoid cyst with skin and appendages like hair, sweat gland, etc. Content: sebaceous cyst content is oily, cheesy material, keratin, sebum, and dermoid cyst thick, greasy material with hair, fat, and keratin. Location: hair bearing area, scalp, face, and back. Very important: scalp, base, and back. That means where hair follicle located or sebaceous gland located. Then embryonic fusion lines, midline face, neck, external angle of eye, midline face and neck, dermoid. Age group: common in adult and common in infant and young children. You know that that is a congenital cyst, so it will just mainly in infant. And punctum present, it's a great criteria. The sebaceous cyst has a punctum, and dermoid cyst has no punctum. And mobility: movable over deeper structure, adherent to skin. Very important. Sebaceous cyst is adherent to skin It fixed with the skin, but mobilization under the structure and freely mobile under skin. It's freely mobile at adherent to skin. But mobile over different structure, it's freely mobile as a consistency. It was a tense, it's tense, and it is a soft to firm, maybe fluctuant. Then transillumination test. It's negative. It's negative. Infectious risks can get infected, become tender and red, rarely infected. Histology lined by squamous epithelium with keratin and sebum. Squamous epithelium are admixture structure. Okay, treatment. Complete surgical excision, including cyst wall. Complete excision without rupture. Without rupture or with rupture. Recurrence. If wall not completely removed, rarely it